Hi, my name is Christina Wynn, and I'd like to talk to you about preventing postpartum hemorrhage. I'm in the nursing research class at the Adventist University of Health Science distance learning program. Understanding postpartum hemorrhage. As we explore further the complicated obstetric field, we are able to understand the importance of keeping our vulnerable patients or postpartum patients healthy by decreasing the incidence of postpartum hemorrhages, therefore decreasing the need for blood transfusion and or decreasing the morbidity rate. We as healthcare providers in the obstetric field must learn to recognize the early signs and symptoms of postpartum hemorrhage, assessment of the current practice, and applying evidence-based practice in order to keep these patients healthy. Interventions to decrease postpartum hemorrhage. Postpartum hemorrhages can be life-threatening to the vulnerable patients. The healthcare provider must learn to recognize the signs and symptoms along with performing the interventions in a timely manner. Through continued evidence-based practice, the patients are able to recuperate from postpartum hemorrhage with minimal difficulty. What is postpartum hemorrhage? How do you decrease it? Postpartum hemorrhage diagnoses are derived from patients having signs and symptoms such as diaphoresis, pallor, restlessness, confusion, and syncope. The patients may even have hypovolemia symptoms which may include tachycardia, oliguria, hypotension, and oxygen concentration less than 95%. The patient's clinical manifestations of these symptoms should alert all healthcare providers to intervene in order to decrease blood loss or even morbidity. Interventions used to decrease postpartum hemorrhages includes fundal massage, medication usage such as Pitocin or Methergin, uterine balloon tamponade, or some type of uterine compression device. Surgical intervention is the last resort for these patients. Postpartum hemorrhage may occur regardless of what we do as healthcare providers. The important point is that we continue to use evidence-based practice to overcome or minimize the damage it may cause. Obstetrics is a highly intense and memorable moment in these women's lives. We have to keep them healthy in order for them to enjoy their precious little babies. Even if one woman dies of postpartum hemorrhage, that is one too many. Her family would be left to carry this tragedy for the rest of their lives. It is up to us to provide the best care possible, and we can only do this through evidence-based practice. Thank you for listening to my screencast.